Dental pulp. The dental pulp is the soft tissue within a tooth containing blood vessels, nerves, and connective tissue. It can be divided into coronal and radicular pulp. The functions of pulp is to produce dentine, that is formative function, nourish dentin, that is nutritive function, elicit pain to protect the tooth, that is protective function, and to repair injured dentine or arrest caries progression by forming reparative dentine, that is the reparative function. Histologically, the pulp has four distinct zones: the odontoblastic zone, which is the outermost layer composed of odontoblast, which are responsible for dentine formation. Next, the cell-free zone or the zone of veil, which is a layer located beneath the odontoblastic layer containing fewer cells. Next, the cell-rich zone, which is located beneath the cell-free zone containing more number of cells including fibroblasts, undifferentiated cells, and immune cells. And lastly, the pulp core, which is the central region containing prominent blood vessels and nerve tissue. Cells present in the pulp are odontoblasts, which help in synthesizing dentine, fibroblast, which produce the pulp matrix, which is the connective tissue of the pulp, undifferentiated cells, which can differentiate into other types of cells like odontoblast or fibroblast, and lastly, the defense cells, which include macrophages and other immune cells that protect the pulp from infection.